Welcome back, welcome back, welcome back to science. All right, in 22.7, we're going to be talking about mammary glands. These are accessory organs of the female reproductive system. Their specialized task, as you're aware, is to secrete milk following pregnancy to nourish a baby. They're going to be the location of the mammary glands. They're going to be located in the subcutaneous tissue of the anterior thorax within the breast. That's right, the mammary glands are within the breast. Nipple of each breast is surrounded by a circular area of pigmented skin called the areola. Now, the structure of the mammary gland is going to be composed of 15 to 20 irregularly shaped lobes. Each lobe contains the alveolar glands, drained by alveolar ducts, which drain into the lactiferous duct that leads to the nipple and opens to the outside. Dense strands of connective tissue form suspensory ligaments that support the breast. Development of breast. Mammary glands of males and females are similar. As puberty is reached, ovarian hormones stimulate development of the mammary glands in females. So let's take a look. You can see the alveolar glands that are there. You can see it culminate in the lactiferous duct, and you can see the alveolar duct that's coming from the alveolar glands. From a different point of view, you can see the areola, the darkened region. You can see where the nipple is, along with the several different pores and openings that are around that, the alveolar ducts, as well as the alveolar glands. All right, treating breast cancer. The most common type of cancer in women is breast cancer. So everybody should be aware of how to check for breast cancer and what it looks like, the warning signs. So this is going to be an area of thickened tissue. It could be a dimple, a change in the contour. The nipple may be flattened or pointed in an abnormal direction, and there may be nipple discharge, which could be anything from a thin liquid to a pus or even blood. Biopsies are used to confirm whether cancer is present in the suspicious tissue. Treatments for breast cancer. There's several different options here. One is just a lumpectomy, where we remove just that lump. Another is a simple mastectomy, removing that mass. Or you can have a radical mastectomy, which is going to remove both breasts. Standard radiation and chemotherapy target actively dividing cells. Cancer cells divide more rapidly than any other cell type, which means they are most prone to be affected by chemotherapy and radiation. The only problem is about 10% of the other cells in your body are also in that that are in reproductive replicatory stages, and so it's going to affect the entire person. Newer drugs keep signals like estrogen and growth factors from stimulating cancer cells to divide. So this is becoming a very pinpointed approach. So self exams and mammograms are helpful in finding cancer early, specifically breast cancer. And so if you did a little bit of work, probably talk with somebody that um, talk to your healthcare provider, number one, and they'll give you some pointers and tips what it is that you're feeling, what it is that you're working to notice. When I was in healthcare, we had an artificial tissue that gave the person an idea of what a lump would feel like inside of a normal breast. It was just a silicone material, but it was pretty useful in giving that person an idea, kind of a calibrization of what they would be feeling for if something ain't right, um, opposed to just getting late stage, being afraid of embarrassing yourself. This is something that's pretty common, guys. It is the most common type of cancer in women, once again. So, this is something that you don't fool around with. And the way you beat cancer is early detection and early treatment. So, waiting to see if it's something bad can be a life threatening gamble. So, things that a healthy person could do is genetic testing. Genetic testing can identify women who have inherited certain gene variants that correlate to an increased risk of developing breast cancer. 5 to 10% of breast cancer cases arise from inherited tendency. All right, guys, this is going to finish it up for the overview on the mammary gland. Next, we have birth control.